What makes cancer care unique here is the focus on the entire individual. We go beyond the latest surgical and radiation technologies, beyond the latest medical treatments, and we focus on supporting the patient all throughout the continuum of care.
My name is Madhur Garg, and I'm the clinical director in radiation oncology. I specialize in head and neck cancers and brain cancers. Today I'm going to talk about a study which looks at quality of life of head and neck patients who are undergoing treatment with chemotherapy and radiation.
Quality of life is a big general term, and what we do is we break it down into different compartments or domains. So it's several questions looking at this different domain from different angles. So we want to know if you can swallow, if you can eat, how do you feel about that? So when you look at all of the questions, you put them all together, you get a good picture of what's going on in the patient's life.
It's not looking at cure rates, it's not comparing treatments. It's looking at how we can make the quality of life of the patient who's undergoing treatment better. How can we reduce the side effects? How can we address social functioning? How can we address emotional functioning during the treatment?
Your main priority might be feeding your family. Your main priority might be keeping a job, because if you don't go to work, you don't get paid. If you don't get paid, you can't continue to rent your apartment. So what happens when you and your family are on the street? So when you have all those other issues, maybe showing up every day for your treatment might not be a priority. And that's something that we need to understand as providers.
Majority of the studies in the past have looked at quality of life before and after treatment. Very few studies, if any, have looked at quality of life during treatment. And that's the differentiator in that study. The assessment is done every week during the treatment and then several times after the treatment is done. What we expect to find is, are there any key time points during the treatment when the patient is not feeling well, feeling depressed? So if we can identify these time points early on, we should be able to address it at the right time in the proper way and hopefully help patients complete treatment as well.